India is fighting COVID-19 at the moment, and lockdown 21 is vigorously going on across the country. And as everybody is hoping that CCMB, as it is having a lot of experience in molecular biology research and other things, they're expecting something to be coming out. So, what exactly the role that the CCMB is playing right now in the research which is going on in the country about COVID-19 and coronavirus?
CCMB is playing multiple roles in this. One first main role of the CCMB is to provide support to the government so that it can take proper decisions, and that depends on primarily the number of tests that are done in efficient manner and accurate manner. So CCMB has taken up the responsibility of leading the testing activity in Telangana state. We have converted our research laboratory, significant part of it, for the testing purpose, and it is now fully operational, and we are testing several hundred every day. And we have also trained the local medical college workers for this testing, for the biosafety, which is very essential, so that people doing the testing are confident and they know what to do. And those people have now gone 5 for each medical institution which is designated for testing, and they are working on their respective institution and doing this testing work. So, having established that, we are in constant touch with the government and interacting with them about the scope of testing and the numbers and how to increase the capacity. We are very actively involved in that, and there are ideas that are being considered for that. While doing the testing, we are also taking the samples from the patients after the test is done, and then using this material for our research purpose. So one of the major activity we are doing is growing this virus in the lab, in the cell culture system, in the lab conditions, in a safe condition, and that gives us several advantages. One is, if you have large quantity of virus, then it can be directly used for inactivated virus vaccine. We are interacting with the companies who have expertise and resources to do such an activity, and with this collaboration we will put our effort to see if there is a vaccine that is possible to come out from this effort. And once the cell culture system is working, this also gives an in vitro assay for trying out new drugs or possible therapies for this virus. So for instance, if when we put the virus to the cell will die, and if we also put the medicine, proposed medicine, then cell will not die. So that will immediately give us idea of if a claimed property of the medicine to be antiviral in this effect can be tested. Large number of research organizations and companies have approached us, and fast, and that is one reason why it is very difficult to make vaccine or have a drug against them. For instance, for common flu, for AIDS, we don't have effective vaccine even now because the virus keeps changing, and it's like moving target, very difficult to hit it. So when we do the larger scale sequencing, which already is going on, we will able to do several things. One, we will understand how fast this virus is evolving, and how different this virus is from other strains that are other isolates that are in other countries. So the growing the virus in the cells culture in the laboratory offers several other advantages. So for instance, we can make this virus for the serological testing, which means we take this virus and immobilize it on a surface and then check with the antibody in the that is coming from the patient to see if patient has the antibody, which will mean that patient has been going through the infection before. So this immediately offers a cheap and easy testing process. It also allows us to test individuals who have recovered from this disease, and after 2-3 weeks we can check their serum, and if they are carrying the antibody, the plasma from this person can be used for treating the people who are otherwise going to die. The limitation of this is that 200 ml is what the blood person can give, and it required for one person. So it's a last resort, but it's not a medicine, but it is a good way of saving few lives using the people who have recovered. So there are limitations, but it's very useful, and many countries are using it. India also is allowing this to be done. So in addition to this, we are also doing the genome sequencing of this virus in the laboratory. So which is very important thing to understand about the dynamics of this virus. Corona family of viruses are known for fast mutation rate in them, and that is how they are very evasive of any treatment. They are like moving target. They change so fast that today you make a drug and tomorrow the virus becomes different and drug doesn't work, vaccine doesn't work. So when we are doing the genome sequencing of large number of these isolates from India, we'll be able to tell which part of the virus is changing, which is not changing. Therefore one can choose what to target and what not to target, and it will also tell us, depending upon how different the virus is from the other isolates in Germany, Italy or US or China, whether the drugs that will be developed and used by those will be effective for us or not. One more very important thing that we know from the sequencing in a large number of isolates is to track down from where the virus has come, what was the pathway it has, whether it originated from Italy, the person came here and that person then gave to whom and how it went on. So if a large number of sequencing is done, we can actually make the detailed, very precise pathway of how the virus has spread. And once we are doing it, then it will give us two main tools. One is how fast the virus is mutating, so we can keep a monitoring on that, and what are the pathways of this virus is spreading, so that we can cut those paths, so those traffic of the people in those directions. So that will be very useful information. So these are the few of the things in which CCMB is very actively involved to try and help the fight against this unprecedented endemic that we are facing today.
It is already known. It's a new virus, and very few days it has been the entire scientific community is observing. So far, since you have been in the molecular biology research, what exactly the nature of the virus and how it spreads?
Although this virus is very new, so before December last year, we did not know about this virus, but we know the property or the biology of this family of viruses in quite in detail. About the COVID-2, one thing we know for sure is how this virus spreads, which is very important information. We know that it doesn't spread through air, it doesn't spread through any other animal, it spreads from human to human, and only through the droplets that come out of sneezing and coughing and so on. So we know exactly how it spreads. So if we practice a certain discipline, we can actually stop the spread of this virus. And today, in absence of any other treatment or drug or vaccine, this is the only way to fight this enemy. Other than that, what we know about the virus is that it probably has come from bat. There are good scientific indicators for that, but it has not come directly from bat to human. It has come through another intermediate animal. There are indications for that, but we do not know yet what is that animal and which live animal market it has emerged. Whatever those are only speculations. There is no clear evidence for that, and it is also quite clear that it is not spreading through other animals or pet or dogs or other things to the human. It's only human to human transmission that is taking place. We also know that this virus is very susceptible to soap. If you cover yourself from others sneezing or coughing by using a mask, and if you touch something, the virus can be stable there depending upon the surface. On the plastic it is stable for a very long time, several days, but on the metals also it is stable for a few days. On the copper it is stable for a very short time, 1 or 2, this has been tested, but on the paper, cloth or cardboards it stays for 3-4 hours. So anything, once you understand this, you know what to do, what to touch and what not to touch, and anything you touch, don't take your hand to your face or mouth or nose. Wash with the soap first, and once you wash with soap nicely, there is no problem at all. You can be perfectly safe with that. So we have to avoid clustering of people together, less mixing, practice social distancing, what the government is saying, all the organizations are telling, and exercise good personal hygiene, which is washing the hands with the soap. And when soap is not available, is not feasible water, then use other sanitizers, although they are not ideal, but in absence of washing the soap, they are quite an effective thing.
The best thing is instead of using always a sanitizer, it's a soap and water is the best available.
Soap and water is the best bet. Sanitizer is the second best substitute. So we should not, wherever possible, use soap. Any soap is good. Sanitizers, some are tested, some are not tested. So I would recommend strongly that focus more on using the soap rather than sanitizers.
You have been telling about a lot of facets of research which is going on in CCMB. One of the main things and another aspect of that is you have been the major important member of the committee which state government has set up. So you have been already started doing this testing and already into developing new cost effective kits for testing coronavirus, and how far you have come, and what is the latest development on that?
So testing is mentioned has been now well stabilized, and we are doing several hundred tests every day. The number of samples that come, we give the results within 12-13 hours with all full reporting and uploading the results. And it's true, we are testing new kits because one of the difficulties we are facing is, in fact, entire country is facing the supply of the reagents for the testing. So we are testing alternate options, especially which are of local origin, so you don't have to depend on the import, because import has become very big problem. Every country is wanting the same thing, and there are some good indicators for that. We are also developing methods which can be very cheap and can be used very large scale, but that's a matter of research. It might take some more time, and we cannot guarantee that it will be successful, but we are putting our best effort, and there are good indications. In addition to these, there are two things, as you mentioned, that the government has made a expert group to seek advice. That very progressive step of state government to take whatever expertise is around and get the best of the possible opinion and then act on that. Telangana government has been very proactive on that, and I'd like to say that when this crisis emerged, they called me to the health department of the state. We had a discussion and we gave what we can do, where we can help. And then onwards, we have been really acting in very close cooperation and collaboration and constant touch with the high level officials who are managing this crisis in very, very commendable way. So two things we have as an expert group, we have given advice. One is to ensure that our healthcare workers are having the best possible PPE, there's personal protection equipments, because they are our soldiers now. If they are not confident, if they are afraid, then and if they fall sick, that will lead to collapse of the system. So government is taking full care, because that is our first and foremost priority, that the people who are in contact with the patients are completely safe and they are looked after well. So that is one thing which government taking all care. And the second thing we have now started discussing recently is that we take a new strategy of testing, which is pooling of the samples. Now we earlier at some point when a specific group was targeted for testing for their travel history and so on, we were seeing a large number of positives. Number of positives what we are testing is much less than 2%, 3%. In this case, there is strategy to pool samples in and then test as a pool, and then whichever pool has a positive, then go back to individual testing. This way, existing capacity can be enhanced by 3 to 4 fold or 5 fold. So that is one thing government is also considering. It will require nothing else. It will require only that there is some closer connect between the sample collection and the testing lab, so that samples can be pooled accordingly, and then much larger number of samples can be tested. For instance, if lab is testing 200, 300, the same lab with the same capacity then test more than 1000 with this pooling strategy. So there's other advice we are doing, and we are also giving advice to the government to introduce the antibody-based testing, which is very important. The antibody-based testing means that, first of all, it's a bit cheaper and easier to do. You don't need big lab facility. You don't need expert technical manpower. Any regular healthcare staff can do it. It also tells that the person is having the antibody. If the person is having the antibody and not the symptom, that means the person has either overcome the infection and person has been asymptomatic and the virus has come and gone. The person has fought well and now it's immune to this infection, which means that so far what we have tested, the number of cases are relatively low. So does it mean that we are having asymptomatic people, which we are not testing because the nucleic acid based testing is expensive and it requires more setup? So by antibody based testing, we can figure out if our population is having some resistance to this for our genetic structure or for environment. We don't know. Those are the interesting things to be explored.
Rightly said. It is very interesting development, especially when recently the governments are observing that asymptomatic people, they are noticing asymptomatic people who have been tested positive. In that context, are you suggesting that, or are you going to take it further?
I mean, we can do with the nucleic acid based testing with the current one at a very large number, but it will be more expensive and it's a slow process. But once we start using antibody based testing, then we will be able to do it in much larger number. And I think at least Telangana government is considering very seriously going ahead with that. That's the impression I'm getting. And that will reveal if we are having large number of asymptomatic cases as compared to other countries, and which will be very good news, because which means we are somehow better equipped immunity wise to face this virus. Inbuilt, there are two ways of being inbuilt for stronger immunity. A, your genetic structure is such that you are stronger, which means either your immune system is strong or the target which the virus goes and catches, and that's so virus to enter the cell, it goes and holds something on the cell, in a way opens the lock and then enters the cell. If the virus, the key doesn't work to the lock which is there on the cell surface, because our lock is little bit different, because we are different, each ethnic group is different, so maybe that is the one reason. So immune system may not be playing major role, but it is our genetic structure that may be playing. We will figure it out sooner or later. The other thing will be that a virus is coming, but we are more experienced in terms of immunity. We earlier had some similar infection. So by doing more extensive analysis, we'll be able to figure that out.
It's quite interesting, Dr. Rakesh. Actually, you were mentioning about the genome sequencing and other. Where are we stand now, and who are all collaborators along with you, since you have taken this much forward on this aspect?
So genome sequencing of this virus is something many people are interested, because that reveals the hidden aspects of the virus, its mutability and many other aspects of biology, and it has immediate implications in controlling and fighting disease, finding vaccine for this virus. So all over the world now more than 5,000 isolates have been sequenced. In India, the virus came here a little bit late. Earlier there were 2 isolates that were sequenced by National Institute of Virology. Now I understand they have sequenced more, some I think 10, 12 or 20 more sequences have been deposited from the CSIR effort, where the CCMB is the CSIR laboratory. Similarly, there is a laboratory in Delhi, IGIB, Institute of Genomics and Integrative Biology. That's also CSIR lab, and CCMB and IGIB together are putting a major effort in sequencing several hundred isolates of this virus. So in coming 3-4 weeks, depending on the availability of the samples, so we are doing testing ourselves, and whatever positive comes, then we can sequence those. We already have over 100 positives with us, so we can sequence those, and we plan to sequence several hundred, putting together IGIV and CCMB efforts. That will give us a major understanding of the speed with which the virus is changing, what has been the route that virus has taken to spread the way it has spread, and a few interesting insights into how successful the vaccination is going to be, and what are the good targets and what are the bad targets in terms of finding new drugs against this virus. So we hope to get insight into such crucial questions.
That means we will be getting some clues about the possible medicine for this or vaccine.
So once we know the degree of variation that is happening, then let's say if the virus changes too fast, then that means we are not going to easily have any vaccine against it, because by the time a vaccine is ready, virus comes in different incarnation, and then it will evading the vaccine, and similarly the drug. So that is possible. That's why more than 3 decades of effort till today there is no vaccine for AIDS, and is one of the best studied virus probably all over the world. So there are ways of handling these diseases, but maybe one method is not good for all. For example, for some time vaccine is good for several diseases. I mean, vaccine has done such a great job for the humanity, but maybe not for certain viruses.
How long the whole process may take?
This is a time-taking process. There are large number of candidates for the vaccines and drugs, and people are working all over. Several hundred drugs and vaccines are being tried today. So, but main problem for that is that you have to first do multiple trials in the humans to figure out how effective the vaccine is. So you give a treatment to a person recovers, whether person recovered because of the treatment you gave, or person recovered because of her or his own immunity. So unless you do random trial for large numbers in multiple places, you don't know the value of your drug or the vaccine. This process takes many months. So a practical, if some fantastic thing happens, everything clicks very well. Maybe in 3-4 months one can have vaccine, but we should not expect that, because that's something very very rare, and so we cannot depend
And
too many.
risky.
Yeah, right. If you have not tested well, you start giving vaccine to people, and you are not aware of its negative effects, and it may do more damage than it benefit to the people whom it's administered. So vaccines will take a year, maybe two to come. So for this pandemic, we are not going to take a vaccine route to control it. For this pandemic, the social distancing, lockdowns, self-discipline.
As you already said, antibody based testing.
Testing is very good to figure out how to implement this social distancing. Who are the people who are more at risk? Who are the people who are less at risk? If there is a lots of tests in certain area, don't let those people go out, and then manage within that local self quarantine or isolation. So the testing, whether it's current way of testing or antibody based testing, enables us how to implement the restrictions or lockdowns. That gives you a precise way. Once you know where the danger is, now you know how to operate. If you don't see the enemy, how you target so you don't have a strategy unless you have the information.
So, as you are saying already, a few hundred or about 100 samples and have been collected to analyze its sequencing. How long it may take to have some inferences from that?
So this is a continuous process we are doing. So every week, alternate week, we will be keep getting 20, 30, sometimes 40 depending on samples. So I think sample size that we get, we are trying to get samples from other states, so it gives us a broader picture of the all over the country, and hopefully we'll be able to get those. We have done all the paperwork that is required, because this infectious thing and there are lots of regulation, and rightly so. You can't deal it like any other chemical or any other reagent, and so but we are hoping that in coming 3-4 weeks we will have decent idea about its mutation. We will by then have several hundred genome analyzed, put together with IGIB and CCMB. We should be able to reach at some conclusions in which will be relevant and useful for practical applications.
So, right now you are getting the samples from Telangana only, or are you getting from other states?
No, we are taking samples only from Telangana, because you see, we need to do much more testing than we are able to do today for the Telangana itself. So it makes a sense that samples are analyzed more locally, so that transport and those things are not complicated, and also there are regulatory administrative systems involved. There is a strategy to collect samples and analyze them. So today maybe in Telangana we are testing 1000 to 1500 or something like that. We're putting all the testing centers together. We would like to do 10 times more, because then we'll be able to be more effective, and government is also aware of that we need do more testing. So at the moment we don't have luxury to take samples from outside, although we don't mind if there is something very unique comes where the quality testing at certain timelines we'll be willing to do that, but it will be done in coordination with the health department of the Telangana state, because we want first to solve problems that are around.
So apart from IGIB, are there any other institutions collaborated with this research, either in India or outside?
There are at the moment, as I mentioned, when we are setting up this cell culture system for the virus, this is something very unique. Nobody else is doing in the country now, but I hope that many more labs will start doing this, because this is something very important. But you need a proper setup for this, which is called BSL-3 laboratory, Biosafety Level 3 laboratory, where such infectious agent can be handled, so one can work safely. And you need some people who understand the virus biology. We call them virologists, so they can work on this virus. So wherever this combination is there are multiple places in the country, but they are probably gearing up to start this. But at the moment we have got messages, proposals from many places, many countries, fewer. Some European countries have approached us because they want to try their idea, their drugs or whatever they have testing methods with us. But large number of national laboratories within the country and an equally large number of entrepreneurs and industry partners have approached us. So this is a time-taking process. We can't test hundreds or thousands in a go. So we will be prioritizing based on the our assessment what is the good thing, scientifically more advanced, and more importantly what is more relevant for our society, because that is the first thing we would like to see. And so we will pick and choose among these and collaborate with them and work together to see if some of those ideas are validated, and so then they can take it forward.
So, coming to the present scenario, the lockdown 21 is going on vigorously across the country, and as you rightly put it, the social distancing and sanitizing individuals is playing top priority for all the governments. So, would you see any possibility of any need to extend the lockdown beyond 3 weeks?
So, if you ask me as a scientist, and I'm, let's say, totally ignorant of anything else, the lockdown should continue. But we know that we have to weigh. If you do something which does more damage than the benefit it is giving to us, then we have to decide what to do. So that is the tough decision that governments will have to take.
Yeah, that was a policy decision.
That
but
is
as a scientist, you can
yeah,
suggest
I,
to
yeah, I
go
think
beyond.
it is recommended. And I'm sure that governments will not take a risk of totally lifting the lockdown. They have to figure out how to provide employment or food and supply. I mean, this society is now so much dependent on transport. We are totally interlinked, and we cannot cut off, and we can fight the virus. But then we can lose on many other fronts. So it's a collective thinking and logistics and holistic analysis that needs to be done by the system, and large number of testing will be very helpful in figuring that out, which part can be still kept locked, which part can be opened, and how you can manage these things. So that is possible if we do large number of testing. That's why government is pushing very, very hard to increase the testing capacity and do more. But I am sure the center and its states will continue restriction. Of what level, of what degree, is not my expertise to say, but I can expect it will be absolutely necessary that different degree of restrictions are in place. For example, you cannot imagine running metro or running city buses at this time, or opening schools, because that will be very, very dangerous thing to do. However, you can open some organization, you can reorganize little bit food supply, and something which is non-essential like a restaurant, cinema hall, big malls, those have to be kept still restricted. Yeah, because that thing. And maybe this will teach us new ways of living life without spreading infection. So maybe some positives will also come out. We are learning many things when any difficult time also has something to teach us, and that's the uniqueness of human race, that we learn from everything. So let's hope that we will get something worthwhile. Of course, we are fighting something unprecedented for the whole human race till now. So the using our cell culture system of the virus, which is our in vitro assay, it gives an opportunity to test many things that can be that can have antiviral activity. So there are lots of traditional knowledge in which people have shown that certain plant products or certain extracts they have antiviral activities. There are many laboratories in our country that are working on this. There's a Ayush ministry is working on many of such things. There are lots of such candidates. So our assay will provide us ways and means to validate those things against this virus. See, we have thousands of years of ancient wisdom which is with us, and lot of them needs to be validated. And these are the opportunities when we can screen through and see what is the real thing, and in which people have contaminated the literature and that is not reliable. Both are true. So we will be testing many such candidates which are coming from other expert laboratories and individuals.
Have you begun anything in this culture of the virus right now?
Yes, we have started culturing the virus. Now we are
with this possible resistance to virus.
For that we started testing about 8 days back. So, and these are the things. First few days we were struggling to set the whole thing, because something very new for us. We are not a hospital. We are not doing testing of hundreds of people every day, just because it's a need of the society. So we have started doing that. But now we are focusing more on the research component, because that's something we can do which others will not be able to do. Testing can be done in many places. So we began that. Now we are seeing some leads coming, in the sense that cells are responding and virus is being produced in the lab. So we have to validate few things that in certain volume how many virus particles are there. Then we will expand that and then start testing, which will take a week or 10 days kind of time.
How hopeful you are to come up with a vaccine kind of thing?
A vaccine against this kind of viruses is the most dangerous prediction to make. It may not come, as you know, for AIDS, for decades people have tried and there's no vaccine today. We were lucky it may come as quickly as maybe 5-6 months. This can be that kind of variability is
But the
there.
effort will be going on.
Effort will be going on. As I was saying that more than 250 trials are going on of various things because the whole world is stunned by this shock. So I think all efforts people are putting into one single thing now. I'm sure many things will come out, but how effective, how soon is anybody's guess.
The entire nation is looking forward and hoping that something will come out which is very crucial in identifying the ways and means to tackle with this menace. Thank you so much, Dr. Rakesh. Thank you so much.
Thank you very much.